It's 12:36. You are listening to the Mid-Morning Talk on Salam Media with me, Mari Mukwanda. Today we're going to be talking about an overactive bladder, what it is, what causes it, how it's diagnosed, and the treatments available with the urologist Dr. Salim Choonara. An overactive bladder, also called OAB, causes a frequent and sudden urge to urinate that may be difficult to control. If you have any comments or questions regarding this condition, please leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Choonara, shukran for joining me once again.
Walaikum salam wa rahmatullahi wa barakatuh. Thank you so much, and to your listeners and your viewers as well.
Alhamdulillah. Right, so doctor, what can you elaborate on what an overactive bladder is and also what causes it?
So, overactive bladder, often it's abbreviated as OAB. People will probably just know it as OAB. And as the word says, very much explanatory in the definition. Overactive bladder, meaning the bladder is more irritable, the bladder activity is heightened. It's not just a relaxed bladder, which would be almost the opposite of an overactive bladder. And often the symptoms that patients complain about regarding the overactive bladder is it's actually a triad on those three very sort of common symptoms that stand out in diagnosis of an overactive bladder. And that is the following: frequency. So frequency meaning going often to toilet, and sometimes it can be as much as 6 to 8 times per day. So that's frequency. Then there's another symptom what we refer to as urgency, meaning the sudden need to urinate and the inability to delay that feeling. You could be sitting with somebody and having a chat, and suddenly you feel you must use the bathroom now. And that can be sometimes tied up with what we call urge incontinence. You get urgency and urge incontinence, meaning you don't make it to the toilet in time, and as a result of that, you may actually you may leak some urine or mess your underpants. And the third sort of triad, the third component of that symptom complex is what we call nocturia. So nocturia simply means waking up at night to go to the toilet. And generally, we regard at least more than 2 times a night to be a problem. Obviously, it's relative to every individual, but I'm just giving you a bit of an overview. So, in the extreme of cases, you find people are waking up almost every hour, 4 to 5 times at night they're going to toilet. So it's obviously that's significant. So frequency, urgency, may or may not have urge incontinence, and obviously nocturia. And now, the causes, that's obviously a wide variety of possibilities. We just think about what could cause an overactive bladder. And there are sort of big groups that we look at. So like the simple stuff would be you're taking a lot of water, as simple as that. You're just drinking too much of water, so obviously your bladder can only hold so much. And as a result of that, you have frequency, and you have the need to go very often to toilet. And you also, it's like some people will tell you that, I drink more water at night. When I'm going to bed, I can drink like a liter or 3/4 liter. Well, obviously, you're going to wake up. The urine's got to go somewhere, So that can be a simple thing. Just your water intake is maybe more, it's excessive, right? Then your other fluids or things like drinks that will irritate the bladder or that will make you produce more urine. So your caffeine-based drinks like cold drinks, teas, coffees, obviously obviously may not be relevant to I would describe like alcohol consumption, etc. So all of those things can wait. It's a stimulant. It's making you produce more urine. You produce more urine, again, your bladder can only hold so much. You're going to want to go empty it more often. It's simple. And then we move on to the more sort of pathological causes. And the common things, again, would be things like infection. Infection of the urinary tract can also basically cause that because the infection causes inflammation of your bladder, inflammation of the bladder lining. So that makes you go more often to toilet. It gives you the frequency, gives you the urgency, gives you the nocturia. So, and it's just an interesting point. Sometimes people will come and say, no, I got a recurrent infection. Every now and I got an infection. But it may not be an infection. They have the frequency, they have the urgency, they have the nocturia, and they feel, it's infection, let me go take a course of antibiotics. But it may not be. It's just that there's an overlap. There's a similar symptom complex, for example, in OAB, and a similar symptom complex in somebody that's got an infection, So a urine analysis obviously may set aside that confusion there. And then the other very big group, and I think we've touched on this in one of our other programs as well, is people that have neurological conditions of the bladder. So anything. So like neurogenic bladders that can be from spinal injuries, that could be diabetic related, where there's a neuropathy. That could be those individuals that have things like multiple sclerosis, any sort of muscle or nerve damage, anything that's interfering with the circuitry of the bladder. Because remember, the bladder is a very complex mechanism. If you think about it, there's two important functions of the bladder. One is you've got to fill, and then you've got to empty the bladder. And the filling of the bladder, you're not even aware when your bladder is filling up. You could urinate now and you have the next sensation in 3 hours on the average person. So that means there's a passive filling up of your bladder, which is quite remarkable. You're not even aware of that. It's when the bladder gets to a certain volume that you have that sensation that you want to go to the toilet. So that's an important component. So anything that interferes with the circuitry, with the nerve supply of the bladder, will interfere with these sensitive sort of receptors that tell you, okay, your bladder is full now, go to toilet. So I think those are sort of broad aspects of the cause.
Mm-hmm. All right, now, what are the risk factors regarding OAB? Who is more at risk of getting it? And also, is it a disease or just a condition that anyone can develop?
Yeah, that's a good question. So if you think about risk factors, generally as people are aging, as you age, that itself is going to lead to a situation where your bladder becomes irritable. As you age, your bladder capacity gets smaller, naturally it becomes more irritable, and you may have other situations. For example, like in men, they may have problem with their prostate now, so it also irritates their bladder. Women may have prolapses of the bladder, they may have recurrent infections. So there may be other things that come up as you age as well. So just simply aging may give you this kind of irritability of your bladder, just because of the capacity of the bladder. In terms of the risk factors, it wouldn't, I wouldn't say it would apply strictly by definition, because this is not really a disease like you mentioned. It's not something I would say overtly pathological, but it's a condition that could come about for various reasons, and it's a lifestyle issue. It may affect your lifestyle. Some people are affected more than others, and that also determines how we're going to manage it, but on the point of risk factors, also, as I mentioned to you earlier on, it would be things like diabetics. People that are diabetic, because they can have a neuropathy, they can be at risk for developing a symptom complex that would be, by definition, overactive, in a sense that it have the frequency, the urgency, and the nocturia. And then the other big other risk factors of this, obviously, for this would be people that are involved in accidents, spinal injuries, and those with neurological conditions. They can also be at risk for developing an overactive bladder.
Mm-hmm. Well, there's a misconception that majority women will experience an overactive bladder. Women who are pregnant or have been pregnant before. Is there any truth to these?
Yeah. So I wouldn't say no. It's a misnomer. Yeah, I would say the likelihood that the incidence is more common amongst females with an overactive or irritable bladder. The interesting thing about that question is that there's almost like different grades, if you would like to understand it that way, of what an individual will perceive as, I've got an irritable bladder, or I've got a weak bladder. You hear people say that I've got a weak bladder. I can't hold my urine. I'm always in the toilet. So they have degrees of what we would then, by definition, term an overactive bladder. And so that is possible. And again, for females, exactly that. Because of childbirth, they may have had previous surgery, hysterectomies, all of those things can interestingly put them more at risk. The point about hysterectomy, and there's an interesting association that we see amongst females, is that those females that have had a hysterectomy, they, interestingly enough, do suffer more irritable symptoms of their bladder. So they may not have all of it. They may not have the nocturia, but they may have, for example, the frequency and the urgency. They may not have the nighttime issue. See what I'm saying? So strictly by definition, when we say OAB, we're talking about that symptom complex. But we recognize that there's varying degrees of these symptoms that people will complain about, which kind of fits in that big group of overactive bladders, if you can understand it in that way.
Mm-hmm. All right, so doctor, please stay with us. So we're going to take a quick break and we'll continue thereafter.
Thank you.
This is Salam Media, and you are tuned to Mariam Kwanda on Salam Media.
Kids these days are smart, and when you're competing for their attention against their smartphones, you need to make smart choices, like using Sunfoil triple refined pure sunflower oil in every meal you make. It's naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether you're cooking, frying, or baking, you get the great tasting results that'll get their attention faster than the latest app. And if that doesn't work, change the Wi-Fi password. Sunfoil. Now we're cooking.
Alhamdulillah, we are finally free of riba. Birkat smells lovely.
Yeah, with Yakina, I managed to stop all the riba, Hajo. This insurance price is going up again.
Oh, we are not free of riba, Babu. You need to stop the insurance.
We have to have insurance, Hajo. You know how bad it is with all the crime and the accidents.
Have a little yakin now, Babu.
Yeah, man, I do have a little yakin. But I wish there was a way to leave all these riba insurance companies, man. There's so much riba.
Babu, I can't handle this. The stench. It stinks.
Is that my underarms?
No, the riba stinks. Please find a way to stop this riba insurance, Babu.
Leaving riba insurance is easier than you think. Call Amana IFS for all your personal and commercial takaful needs. 0861 786 393. Amana, leave riba for good. Amana IFS is a registered financial services provider.
Africa. As the crisis in Palestine continues, the Africa Muslims Agency teams are on the ground facilitating emergency food and medical assistance to the affected families. Donate 15,000 rand or any amount and help the people of Palestine. Call AMA now on 083-251-9376 or donate online at africamuslimsagency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
Rejuvenating media day by day. This is Salam Media.
12:48, we are talking about an overactive bladder with Urologist Dr. Salim Choonara. If you have any comments or questions, please leave them in the comment section below or send them to us on WhatsApp. The number is 061 766 0355. Dr. Salim, shukran for staying on the line. Now, how is an overactive bladder diagnosed?
Sorry, Mariam, I just lost you for a second there. I just lost you for a few seconds.
Yes, how is an overactive bladder? Can you hear me now, doctor?
I can hear you now.
Is it better?
Yeah, it's better.
All right, alhamdulillah. So how is it diagnosed? How is an overactive bladder diagnosed, and what treatments are available?
Absolutely. All right, so obviously with any diagnosis, that's why I spent a bit of time to discuss the symptom complex that comes with that. So that's the first clue. You know, if we see somebody in our rooms and they having this triad of symptoms, frequency, urgency, nocturia, already we know that we could be dealing with an overactive bladder. Thereafter, what we do is a simple ultrasound or on the bladder. We measure how much of urine can this individual hold in their bladder, and when after they've emptied their bladder, how much of urine still stays behind. This gives us an indication about, you know, a very irritable bladder you will not be able to hold much urine. For example, at 150, 200 mils, you want to feel like you're bursting now, you know, whereas the average person could go on to about 400, 450 mils. So already you can get a gauge, okay, this patient's bladder is irritable, that's why they can't hold for too long. Then we do a urine test to check for any possibility of infection. These are the simple tests which we do at our rooms in the doctor's room, at the office, all right? And then the more advanced tests that will come about will be a neurological assessment, which we'll do at the rooms again. And then as I said, when you examine the patient, you already get an idea about their past medical history. So you know, is the patient diabetic? Have they had some spinal involvement? Is it neurological aspects that may come into play? Do they have multiple sclerosis, etc.? So you already know all of that, right? But in terms of actually diagnosing an irritable bladder, medically what we use is what we call a urodynamic study. So it's a specialized study where it's a bit invasive because one has to put sort of a catheter into the bladder with some sensors on it, and then there's a series of tests and commands that one has to follow. And the ultimate aim of that particular exercise is to detect the pressure waves in the bladder. In other words, as I said to you, the bladder filling is a passive filling. You don't even know that your bladder is filling up. But somebody with an irritable or overactive bladder, the minute urine sort of fills up in their bladder, already their muscles start to want to contract. That's what gives them that feeling to go to the toilet. And that is registered by the sensors that are placed in the bladder. The minute the muscle contracts, we can pick up that wave of contraction, which shouldn't happen during the filling phase. So it's a complex study, but it's a very useful and a very important diagnostic tool. But like I'm saying, we don't always apply that to every single patient that we're dealing with. Often, the symptom complex, the examination in the rooms, the exclusion of an infection, and the understanding of the risk profile is enough for us to make a reasonable diagnosis. We will use the urodynamic study in younger patients who have multiple other comorbidities, and we want to be certain that this is definitely an overactive bladder. Then we go the UDS, but it's not done routinely. And then obviously, as part of that assessment, we also put a camera into the bladder, what we call a cystoscopy, to assess, make sure that there's nothing else that's causing irritability to the bladder. The one thing I forgot to mention to you in terms of causes, which is also a big group, is things like bladder stones. They can also function similar to causing irritability to the bladder, or things like malignancies or cancers of the bladder. They can present similar. In other words, there's something that's irritating the bladder. And as a clinician, we must find out and sift out the minor things from the more complicated things. Because the symptom complex of frequency, urgency, and nocturia can overlap with other things, not only just overactive bladder. That's an important thing to understand, right? That's why it's important to go through a whole series of tests and diagnostic tests and assessments to make sure that you've excluded other urgent things and you know exactly what you're dealing with. In terms of treatment, so we follow a stepwise treatment. Obviously, I said to you earlier on, Mariam, is that sometimes the simple thing is that you're just excessively drinking fluids, or you're taking a lot of caffeine-based drinks, or that's what you're doing. And so one is so maybe it's a lifestyle change. Just change what you're doing with your fluid intake, as simple as that. But that's the simple approach. And then obviously we use medication as well. So tablets that are available are things like your Vesicare, Betmiga, Ditropan. Most people that have overactive bladder will be familiar with these kind of tablets. So these are usually once a day or maybe 2 or 3 times a day that is required to be taken, a dosage. And what the tablet does is it relaxes the bladder muscle. So by doing so, it allows the bladder to fill a little bit longer, because the bladder is like an elastic reservoir, When it needs to fill, the muscles need to stretch and stretch before you have the need to want to go to toilet. So the overactive bladder is that the muscles want to contract much earlier with a smaller volume. So the tablets allow the bladder muscles to relax so that it can hold a lot more volume before you need to go to the toilet. All right. So most people respond well to that, and sometimes it happens that people need to be on treatment for a long, extended periods of time. There may be some drug holidays in between, but generally, people that have an overactive bladder require a long-term treatment. Now, let's say we're in a situation, just to summarize it quickly, if the tablets don't work, then we do have I would say, minimally invasive option available, and that is what we call intracycle Botox treatment. Meaning we inject Botox into the bladder muscle. So that's why it has to be done in the theater, because we have to put a camera. It's not a big operation. There's no cutting at all. But one has to be able to at least get a camera into the bladder, visualize the inside of the bladder. With a special needle, we obviously prepare the Botox in a certain way. We mix it in a certain way. And then we inject the Botox at different sites in the bladder. So often about 20 sites at different positions in the bladder. And that works very, very well, because remember, the Botox, again, functions to relax muscle. And in this case, it relaxes the bladder muscle. Works very, very well, works very, very efficiently, because it's working exactly where the problem is. Unlike having to take a tablet, and then eventually the active ingredient will get to the bladder and give you some relief. So the Botox tend to work, I would say, in most patients, even those that are refractory to medication. We find that they do respond well to the Botox treatment.
Well, it does sound like a painful process, but as long as it provides relief, then yeah, that's great. Now, quickly, what can we do to avoid getting OAB, or is it avoidable?
Yeah. In essence, it's not really avoidable, because it comes about by certain conditions that may predispose you to developing it. So, there's only really one that can do. The only thing is, an individual can control those situations is in the lifestyle aspect. And what I mean by that would be like I explained about the fluid intake, avoiding heavy caffeine-based things. Besides that, but in terms of lifestyle, it would be in terms of things like conditions like diabetes, being overweight, especially I forgot to mention that to you as well. So that's where an individual has control of that situation. Because if you're overweight because of the excess pressure, excessive abdominal pressure on the lower abdomen, on the bladder, can itself cause irritability to the bladder. That can also give you constipation, give you bowel issues, which can again affect your bladder. So from that perspective, living a healthy lifestyle, exercising regularly, not becoming overweight already will put you in good stead. Remember, no matter what you do, but I mean, if you're going to develop, for example, a cancer of the bladder, or if you're going to develop diabetes, or you're going to develop some neurological condition, there's not much one can really do, in preventing that. That's a difficult thing to say. I can prevent getting multiple sclerosis. I can prevent getting diabetes. Yes, you can, in the sense that lifestyle. That's what I'm saying. The whole issue of obesity may come into play even with diabetes. But we know people that are overweight, they are also predisposed to getting diabetes. So maybe one has some role in that aspect. But by and large, I would say living a healthy lifestyle is an advisable option. But strictly speaking, one cannot simply say that I can avoid myself getting an overactive bladder. I don't think it applies strictly to this kind of understanding.
Mm-hmm. All right, that's all the time that we have. Shukran for your time, Dr. Salim, and for that information. Have a wonderful day. Assalamu alaikum.
Thank you so much. Assalamu alaikum.
Dr. Salim Choonara, a urologist, taking us through an overactive bladder, or OAB, the causes and treatments and diagnoses that are available for it. If you feel that you might be having such a condition, perhaps go to your doctor, your GP first, and just tell them what you're feeling. Perhaps it could be an overactive bladder. One of the symptoms could be, frequent urination, frequent urge to go to the toilet. Another one could be getting up in the middle of the night to go to the toilet again. And sometimes these things like getting up in the middle of the night can just be because you had too much to drink in the evening. If you want to prevent waking up at night, then don't drink so much liquids past 8. Yeah, don't drink so much liquids past 8, so that you can avoid having to wake up in the middle of the night and go to the toilet. And that will also make you less stressful and grumpy the next morning. Also, watch your caffeine intake, because that could contribute to the urine building up in your bladder. So yeah, it all comes down to your lifestyle changes and what you do, how you do it, what you consume, etc. That will either give you OAB or will prevent you from getting OAB. All right, so if you have any further comments or questions, please leave them in the comment section. It is 12:59 right now, and time for me to love and leave. We'll be back tomorrow from 11 to 1 p.m. right here on Salam Media. From myself, Mariam Mukwanda, and the Salam Media team, Assalamu alaikum wa rahmatullahi wa barakatuh.